CataractCoach.com. This patient has Fuchs Corneal Dystrophy. So why did we implant a trifocal IOL? Now, the normal teaching here is because of the Uday and the corneal edema, the Fuchs patients have increased light scatter. And placing a diffractive optic in the eye, such as a multifocal or trifocal lens, may not be the best choice. If we zoom here on high magnification, we can see the presence of diffuse Uday here. Now, fortunately, the endothelial cell count's pretty good at 1,600 cells per square millimeter. Certainly it's low, but it's not terrible. And the patient has a central corneal pachymetry of 584 microns. And importantly, the patient's asymptomatic. She does not have the characteristic morning blurriness that takes a couple hours to resolve. We've made our phaco incision here at 90 degrees superiorly because the patient has a little bit of astigmatism there that we want to neutralize with our phaco incision. So we'll finish up hydrating the lens, doing hydrodissection, and now we're going to put in some extra viscoelastic, very important, more dispersive viscoelastic. We want to protect the corneal endothelial cells as much as we can, and we're going to operate within the capsular bag. So we'll do phaco chop in the bag, and we're going to operate low, away from the corneal endothelium. Here comes the phaco probe, here's the chopper. The rest you know, we're not going to talk about phaco chop here. The nucleus was removed with a bare minimum amount of phaco energy. The end of the case here comes the IOL. Again, it's a trifocal diffractive design. So why would I put this lens in this patient? Now, if there was more severe Fuchs dystrophy, I would say for sure put in a monofocal lens. It's the better option. And in fact, even aim for a little bit of post-op myopia in case you have to do a DMEC surgery later, and then you have a refractive shift from that. But in this patient, we're aiming for absolute plano with this trifocal lens. And the surprise here that I didn't tell you yet is the patient has metastatic pancreatic cancer. And she underwent a very large surgery, a Whipple surgery for her pancreas. And she was very frustrated that she could not see anything while in the hospital for that surgery. She's a +4 hyperope for distance, and she wears +650 for her reading glasses. And nowhere in the hospital could she find an appropriate pair of glasses to help her. So she absolutely wanted to have her eyes fixed so that she could see well near and far without glasses for the rest of her life. And I'm very much in agreement with her. That's a great decision for her. She had a beautiful result from the surgery. She achieved 20/20 vision for distance, J1 acuity for near. Patient's very, very happy. Now, will the Fuchs dystrophy decrease the cell counts with time? Will the pachymetry get a little bit worse? Certainly all those things are possible. But even if this patient lives 10 years, I think the patient still won't need an endothelial cell transplant. And the reality is, with the pancreatic cancer, this patient may live only a year, maybe even less. And she wants to have the remainder of her life great vision and no need for glasses. And in this case, that's a very reasonable option. The last bit of the surgery here is just doing a very small limbal relaxed incision. That paired with the phaco incision will decrease that steep astigmatism that's at the 90-degree meridian. Check out CataractCoach.com, our teaching website. A lot of great material here. I think you'll like it. You can find neat cases like this. You'll learn a lot. Sign up for a free daily email and even submit your video. If you have an interesting case, we want to learn from you. Check it out.